Welcome to week 8 of the Kid and Parent Pregnancy Show. I'm Asha. You may wonder why you have to undergo a host of diagnostic tests during the doctor visit every month. In this show, we will discuss these diagnostic tests. We will also talk about when most women break the news of their motherhood. Changes taking place in mother. Uterus will feel enlarged on an internal examination by the obstetrician. You may feel the need to urinate more frequently. Some women develop acidity around this time. You may find your gums bleeding a little. This is very common during pregnancy. However, get your teeth checked by a dentist to ensure that there is no gum disease. You may continue to have a few bouts of nausea and fatigue. Some of you may face mild abdominal cramps. If they become intense or you have bleeding, contact your doctor immediately. Increased saliva is one of the strangest symptoms of pregnancy. This may be due to either increased saliva production or a decrease in the amount of saliva. This may be due to either increased saliva production or a decrease in the amount of saliva swallowed by the women. How is baby doing? Your baby is growing rapidly. His elbows and the tip of his nose begin to take form. Major improvements in the limbs are completed with the formation of fingers and the separation of forearms, arms, and shoulders. The nerves in his brain form a network of brain tissues which serve the baby throughout his life. His back straightens out more. Did you know? It is surprisingly common for a father-to-be to start gaining weight, getting morning sickness, and even feel cramps in his lower abdomen. This condition is known as sympathetic pregnancy or the Kuwait's syndrome, which comes from the French word Kuwait, meaning to hatch. Regular checkups. You will undergo a urine test, blood pressure test, weight check, and a fetal heartbeat check during every doctor visit. These are done to check the healthy growth of the fetus as well as your well-being. Urine test. This test is done to find out the level of sugar and protein in the urine. High level of sugar could indicate gestational diabetes, which develops around the 20th week of pregnancy in some women. High levels of protein in the urine could indicate urinary tract infection, kidney disease, or high blood pressure, which sometimes occurs in late pregnancy. Blood pressure testing. Your blood pressure will be checked during every visit. Normal range of blood pressure in Indian women is between 90 and 60 to 120 and 80. If your blood pressure is 140/90 or higher, this indicates high blood pressure. High blood pressure that develops after 20th week of pregnancy is known as gestational hypertension or preeclampsia. Weight checking test. Your doctor will check your weight at every visit. The recommended weight gain during pregnancy varies from country to country. In India, the normal weight gain during pregnancy across the 3 trimesters is approximately between 10 to 12 kilos. Eating a healthy, balanced diet and simple exercises will help maintain a steady progress with regards to weight gain. If you notice an alarming increase or decrease in weight during pregnancy, consult your physician. You should inform your doctor if you do not gain enough weight for 2 weeks continuously. Fetal heartbeat checking. From regular monitoring of heartbeat of the fetus, you can ensure that the baby is growing healthy and normal. You will be able to hear the fetal heartbeat from 9th week onwards with use of an electronic device called Doppler device. Using a regular stethoscope, you can hear the heartbeat only from 20th week. An ultrasound scan can pick up heartbeat as early as 6 weeks into your pregnancy. Tests during pregnancy. Here is the list of main tests and procedures you might undergo during pregnancy. First trimester. Blood test, ultrasound scan to determine the growth and age of the fetus. The thickness of the skin at the back of the neck of the fetus, known as neutral fold thickness, is also measured. This is an indicator of genetic concerns. Second trimester. Testing for diabetes in pregnancy, tests for genetic disorders, ultrasound scan for fetal anomalies. Third trimester. Ultrasound scan if recommended by your doctor. Labor preparation test. This is an outline of the diagnostic test. Your doctor will advise you about additional tests from time to time. Tip of the week. Get your teeth checked by a dentist to ensure that there is no gum disease. Sharing the news about your pregnancy is a matter of personal choice. Some women like to share the joy with friends and relatives right after they miss their periods. On the other hand, some women feel it better to keep the news to themselves till the end of the first trimester, or as long as their baby is not announcing himself in the form of a bulging belly. There are advantages and disadvantages to both telling late or early. You get lots of support and advice from the beginning if you tell early. On the other hand, sometimes this support and advice can get on your nerves as well. So, this is a matter of your personal choice when to inform others. Informing your boss. Timing the announcement to the boss can be slightly tricky. You should consider your employer's viewpoint before breaking the news of your pregnancy. What is the employer's approach towards maternity and how they have dealt with other pregnant women in the company? If you feel that the approach is positive, you can break the news early. You might avail any extra benefit given during pregnancy as well. Your employers also get enough time to arrange your replacement during your maternity leave. On the other hand, if you think your employer might not react positively to your pregnancy news, you can hold on till week 20 or so. By informing your employer when you are halfway through your pregnancy, you give them the signal that you're capable of handling the situation. You should make sure that they first hear the news directly from you. Most governments today have regulations protecting the rights of pregnant women at the workplace. Take the time to read and understand these. Inform your boss early if you have a very stressful job and want some change, have any complications of pregnancy and may need extra time off, sure of positive response from your employer, so want to share the joy with them. Words of wisdom. We would like to share this beautiful thought by Nikki Dalton with you. Feeling fat lasts 9 months, but the joy of becoming a mother lasts forever.